of renal function. In this chapter, we're mainly going to talk about obstructive disorders. That would be hydronephrosis and renal calculi. Although cystic kidney disease or PKD is an inherited disease, a genetic disease, we won't focus too much on this in this chapter. So let's get on to what happens when we have obstructive disorders in the kidneys. Consequences of extreme dilation of the renal tubules creates a condition where the kidney fills up with urine, and we call it hydronephrosis. That increased pressure inside of the renal capsule creates kind of like a compartment syndrome, like what we get in when we put on a cast and it's too tight on the arm. And that compartment syndrome compresses the blood vessels inside the kidney, causing renal ischemia. That renal ischemia then can kill off the tubules in the kidney, creating kidney disease. The other problem that happens when there's stasis of urine in the kidneys is that urine is a great medium for growth of bacteria, and so there's a high risk of infection. And or some people are prone to creating stones out of this material, and then the stones create further dilatation and problems. Renal calculi, or kidney stones, are generally caused by a variety of things: dehydration, infection, the pH of your urine, immobilization, or diet can create situations where you form renal calculi. Other diseases, such as having hyperparathyroid and or gout, would also predispose you to having the ability to form kidney stones. We're not going to focus a lot on the types of kidney stones, but you can see there are different kinds of kidney stones. They're made of different materials. Therefore, we can use different medications and diet to help control the formation. This is a nice table that talks about contributing factors of kidney stones. Not that you need to memorize this, but understand that acidification of the urine or alkalization of the urine is the main driver of what we do in terms of treatment. Urinary tract infections occur when bacteria enters through the urethra. It can also occur when urine remains in the kidneys or in the bladder, creating a nice venue for bacteria. Glomerular damage is where the actual glomeruli in the kidneys get killed off. This creates a problem that allows increased permeability to proteins, and hence the first sign and symptom of kidney disease is generally proteinuria. That creates all sorts of other problems because that protein is supposed to be in the body, maintaining our fluid and electrolyte balance, mainly our fluid balance. And when it isn't, it creates an opportunity for hypoproteinemia to occur, which can create decreased plasma pressure and create There are generally two types of kidney syndromes that occur. We have nephritic syndromes and nephrotic syndromes. Nephritic syndromes are generally caused by an inflammatory response, and this inflammatory response then creates a decreased permeability of the membrane, creating the signs and symptoms that we see of blood in the urine, hematuria, a mild proteinuria, a diminished glomerular filtration rate. In the severe cases, you would see oliguria, lack of urine totally, edema, and hypertension trying to make up for that loss of protein. In acute glomerular nephritis, we see strep as the major infectious agent. In nephrotic syndromes, we see continuing increased permeability of the glomerular membrane, resulting in massive proteinuria, generalized edema, and salt and water retention. Additionally, with those proteins, there's some clotting proteins that get lost, so you see bigger, far more impactful changes that occur in the body. I think there's a YouTube video that I posted on nephrotic syndrome and nephritic syndrome that really summarizes the steps in a very succinct way for you to learn. Other interkidney diseases that can occur are the Tubulointerstitial Disorders, acute tubular necrosis, pyelonephritis, either chronic or acute, and drug-related nephropathies. So we can cause kidney failure just by giving patients medications. With pyelonephritis, this is an infection, a bacterial infection of the upper urinary tract. The signs and symptoms include fever, backache, difficulty urinating, frequency and urgency, very much like a urinary tract infection signs and symptoms, including the nausea and vomiting. It's important to treat both acute pyelonephritis and chronic pyelonephritis early, because it can lead to sepsis, and renal failure can occur as a result.